Now here's a very specific technique for iliacus in particular. So we know that this muscle covers the medial aspect of the iliac bone, and it's basically facing towards the pelvis. Now, in order to be able to access this area, we have to make sure that the abdominal wall is quite soft. So you've noticed that I've placed 2 pillows under the client's knees, so they could also bring their knees and put their feet flat on the table. That would allow the abdominal wall to be quite soft and allow us to penetrate through. So I'm going to place my finger, this is ASIS, I'm going to place my thumb, just above that in the abdominal wall, and then scoop my thumbs on the medial aspect of the iliac bone. So my vector of force, or my intention, is basically to go medial to lateral towards the bony surface. Now obviously I won't have my thumbs far in to actually be medial to lateral, but that's my intention. I'm trying to basically scoop in, but then orient my pressure outward. I definitely don't want to press anterior to posterior into the abdominal content. So make sure that you have enough skin slack, stretch it over, scoop on the underside, and then apply the pressure medial to lateral.